And Joan. Okay, perfect. When we have made quorum, Ryan, we can go ahead and get started. Thank you.
Wonderful. Thank you, Sarah. So is Tamara with us?
I do not see Tamara at the moment.
Okay. Would you like me to begin with her statement, or do you want to come back to her for that?
Sure. Yeah, we can go ahead and just get started from the top if you feel comfortable.
Right. Thank you, Sarah, and welcome everybody. Welcome to the Maricopa Regional Continuum of Care Board meeting. Let's go ahead and call the meeting to order at 1:30 p.m. My name is Ryan Balch, and I'm the COC board chair. I am not with Community Solutions, though. I'm with the City of Chandler. We should shortly be joined by Tamara Wright, who is also my co-chair, but I'm just taking over a little piece for her so she can get logged on. So before we get started, we wanted to just take a moment to say thank you so much for your care and dedication to those who are experiencing homelessness. We wholeheartedly acknowledge that working in our field, serving those who are experiencing homelessness is a thankless job, and we appreciate all of your hard work and dedication as COVID has brought about more challenges to an already marginalized population. Thank you all from the bottom of our hearts, and please know that we are all in this with you together. I'm going to skip this next part if you guys don't mind. It was Tamara introducing me, so I'm just going to introduce myself. So I'm very happy to, as I said, my name's Ryan Balch, and I'm very happy to join Tamara as the other co-chair for this board. I'm now going to ask Sarah to commence with roll call of each of the board members' names and ask that you introduce yourself and your organization.
Thank you so much. Great. So Ryan Balch just introduced herself, and we have Eric Cole.
Hi, Eric Cole with Arizona State University Watts College, and congratulations, Ryan. It's great news.
Thanks, Eric.
And next we have Liz DaCosta. Okay. Next, Marshall Franklin. Skipping right along, Tad Gary.
Hi, Tad Gary here with Mercy Care, and similar to Eric, I want to congratulate Ryan for the chair position. Definitely well deserved, and excited to join your leadership.
Thanks so much, Tad.
Thank you. And next we have Sam Jackson.
Hi, everybody. Samantha Jackson, Downtown Phoenix Partnership, and also very excited to see Ryan in this leadership role.
Thanks, Sam.
Great. Next we have Bruce Liggett. Okay. And Joan Service next.
Hi, Joan Service, Arizona Housing Coalition. I'm not going to say anything special. No, I'm just kidding. I'm totally going to say good job, Ryan. So excited for your leadership.
Thanks, Joan.
And next, Charles Sullivan.
Charles Sullivan, ABC Housing, and congratulations, Ryan.
Thanks, Charles.
Thank you. And last but certainly not least, Ryan's co-chair, Tamara Wright.
Hi, everyone. Tamara Wright here, Community Solutions, and congratulations, co-chair.
Woo woo. Sarah, I think we might have missed Jackie.
Oh my gosh, please forgive me. Jackie Taylor.
I thought I might have been fired.
Never.
Not even close.
Never fired.
Jackie Taylor saved the family. And Ryan, it is awesome to see you and Tamara working together on this. So thank you so much.
Thanks. I couldn't have a better partner in crime. Did we miss anyone else, perhaps? Okay, and I also want to welcome MAG staff. We are skipping their introductions today because we have a very full agenda, but they do so much for us, so welcome MAG staff. If all participants would please mute your phones or computers when you're not speaking, I'd appreciate it. And also, please don't put your phones on hold or we will all be forced to listen to a whole bunch of fun music and advertisements. I'd also ask that all participants please identify yourself when speaking. We will be reminding people to do that throughout the meeting. And one final housekeeping note, all votes will be roll call votes today. Sarah will call the roll after each motion is made. Members of the public were given an opportunity to submit written comments relating to this meeting at azmag.gov/comment within 1 hour of the posted start time for the meeting. Sarah, were any comments received today?
Not today, Ryan. Thank you for
Okay.
asking.
Thanks so much. And I encourage anyone who does want to participate verbally or in writing to please know that we have this opportunity and to please take advantage of that. We'll move on to our next agenda item. Our next agenda item is the approval of the consent agenda. Items 3A through 3E are on the consent agenda. There is some very important information on the agenda that I hope you've reviewed. Our goal for future meetings as time allows, is to have live updates from the committee and subcommittees as a standing agenda item for presentation. As a reminder, please note that board members may request that an item be removed from the consent agenda if they would like to have a discussion. Board members cannot comment on a consent agenda item without first requesting it to be moved to discussion. Does any member of the board request a discussion of any of the items on today's consent agenda? If so, please state your name and we will move it.
Jackie Taylor, so move.
Okay, Jackie, do you want to, which item would you like to be moved?
Oh, gosh, I'm sorry. I thought we were moving to.
Oh, nope, you don't have to move it.
Okay.
Not yet. Hold on, Jackie. We're almost there. Okay, so hearing none, here you go, Jackie. Do we have a motion and a second to approve the consent agenda?
Motion to approve.
Thank you.
Second, Tad.
Thanks, Tad. Now I'll ask Sarah to proceed with a roll call. Please indicate clearly how you choose to motion, stating yay or nay after your name is called.
We'll first start with co-chair Ryan Balch.
Yay.
Thank you. Eric Cole.
Yay.
Thank you. Elizabeth DaCosta. Marshall Franklin. Tad Gary.
Yay.
Samantha Jackson.
Aye.
Bruce Liggett. Joan Service.
Yay or aye?
Thank you. Charles Sullivan.
Okay.
And Jackie Taylor. I did not forget about you.
Yay.
Thank you, Jackie.
Yay.
And then co-chair Tamara Wright.
Yay.
The motion passes. Thank you.
Awesome. Thank you, Sarah. Now, Ty Rosenstiel, Director of HMIS and Database Resources at Crisis Response Network, will present the 2021 System Performance Measures data for information and discussion. Do we have Ty on the line, Sarah?
Yes, we do. Ty, we are ready for you to go. Thanks.
Awesome. Hi, Ty. Thanks for being
All
here.
right. Awesome. Hi, everybody. My name is Ty Rosenstiel. I'm the Director of HMIS and Database Resources at Crisis Response Network. I have the privilege to get to share information that was submitted to the U.S. Department of Housing and Urban Development, HUD, on behalf of our Continuum of Care. Included in the board packet was the full submission of the system performance measures, of which I'll be highlighting just a few key important metrics. I want to confirm that everyone sees my screen. It's a PowerPoint slide. Yep.
Yes.
So
Yes.
that I like to give the presentation on for understanding system performance measures and understanding this overall metric is through the U.S. Interagency Council on Homelessness framework of ensuring that homelessness is rare, brief, non-recurring, and that those housing programs have an emphasis on job and income growth. So in the presentation today, I'll be going through each of the different metrics that are labeled in the different purple boxes under that framework of ensuring that we have a system that is rare, brief, and non-recurring. In terms of how the particular metrics were selected that I chose to present today, In the NOFA application process for the 2019 calendar year, HUD allocated approximately 50% of the NOFA application points to system performance and overall system performance. Not only the measures themselves, but the related strategies associated with improving those metrics in a community. So you can see the system performance and performance strategic planning rated 50% of the points in the overall ability of a continuum to retain and grow their overall funding through the HUD, NOFA, and continuum of care process. The first number of items are drawn from the point in time data set. So I'm going to go through these relatively quickly because the data is not new. The first number of slides here are really point in time data that are associated with 2017 through 2020. And they're really just as a point of reference. These are evaluative measures from the US Department of Housing and Urban Development, but the data should not be new. Just in terms of orientation, all of my slides are going to be the same format. On the left-hand side, you're going to see what the overall measure is and what the populations are that are used for calculation. And then at the bottom of the screen, we're going to see a desired trend indicating that HUD would like to see that measure go up or down, and then our actual trend of what we're seeing happen in our community. So I'm going to go through these pretty quickly. The PowerPoint presentation will be available afterwards as well, but hopefully just the orientation of the slide will help guide people. So the first is the total homelessness for both sheltered and unsheltered. We see this number rise from 2017 through 2020. We don't yet have our 2021 data. The next slide looks specifically at the family homelessness population, looking at sheltered and unsheltered. And again, in this arena, we'd like to see that trend go down, but overall, we've been seeing that trend go up. So this is another area where we would not be meeting that particular indicator. Next area in which HUD evaluates is chronic homelessness. This is the total number of people sheltered and unsheltered. Again, we have the inverse trend where we have total chronic increasing and growing in our community, and the desired trend would have that decrease. Next is specifically around veteran homelessness, looking to see that number decrease. All intents and purposes, not a lot of change here, but from a comparative purpose, our trend has been upwards when we would, as a community, wanting to see that trend go downwards. Next is specifically for veterans, looking at unsheltered veterans. There is a particular emphasis on this in the 2020 NOFA application cycle, looking at unsheltered veterans, and that number remained essentially unchanged, or if HUD were to award points, we would not receive that because our trend was an increase from the previous year. We now shift data sources. So all of that was point in time data related to performance as the overall metrics of the system. Now we move into those system performance metrics, and this is what aligns with what was submitted at the end of the packet today and where we'll spend just a few more minutes. So the first metric is looking at the total number of clients within the entire homeless system, those in emergency shelter, transitional housing, and safe haven. The total number of people that are new homeless. So these are people that have not been in the homeless system in the past 24 months. We desire to see that trend go down. And in our community, we have seen that number go down in our system. Next measure is length of time in shelter. This is looking at emergency shelters, transitional housing, and safe havens. So these are our traditional shelter projects. And we are looking to see the number of days in shelter in a 1 year time period. We want to see that go down. And in our system, we've seen that either stay the same or go up. We've had a number of presentations about this in the past. The key thing to remember here is that we don't have huge fluctuations in our number of shelter beds. We've not seen increases in shelter beds. We've not seen drastic decreases in shelter beds. So this number is a straight reflection of the number of people that are able to be served by emergency shelter over the year. So we're not serving more people in those shelters on a year-to-year basis, so that number is not going down. You can see this number go down either by increasing shelter beds or really increasing the flow of people through shelter. Next slide, we start to see different changes. So This is looking at the percentage of persons that are entering housing from emergency shelters, transitional housing, and safe havens. So from our traditional shelter programs, are they entering into permanent destinations? This is recorded exclusively as a data field collected at the point of exit from a shelter. So a big piece of this is that a number of our shelters have done a really great job over the past couple of years doing better at data collection, being able to better respond to the persons that are exiting their shelters and collecting that data more accurately. But also we do believe that there is a true trend of people exiting shelters to more positive destinations. Next item, this is probably one of the more complex calculations. It's a measure called housing retention. This one is looking at permanent housing types, excluding rapid rehousing. So this is the permanent supportive housing programs, the permanent housing where it may be HUD funded or not HUD funded. This would be the the ARM programs, the 209 West Jackson programs, right? So it's the programs that offer supportive services, but may or may not be continuum of care funded. The idea is, are the people exiting to positive destinations or are they staying in their units? Either of those are positive housing retentions. So we have very high rates and the increasing metric, seeing that people continue to stay in the units and that percentage is increasing is a very good thing. Next slide, in the Making Homelessness brief and Making Homelessness non-recurring is looking at the overall returns to homelessness rate. This one is complex in how it's calculated, but easy to understand. You effectively choose a cohort and then you follow that cohort over a 2-year time period. This particular measure looks at the returns within 365 days. There was a recent Arizona Republic article that did cite this figure. The figure that they cited was 25% returns to homelessness as a system overall. That was the 2-year measure, so that was the 24-month measure. The 1-year measure for the past year was 18%, and that does represent a decrease from last year. So this is people exiting from any of our program types to a positive destination and then returning to homelessness thereafter. Again, this particular metric is at a 1-year time period, but if you review the materials, you'll see the full breakout of that. The last 2 metrics that I have are around income improvements. The first thing to note about these particular earned income improvements and non-cash income improvements that I'll present on next is that this is only for continuum of care funded projects. So it could be for any of the program types that could be continuum of care funded, but it's exclusively continuum of care funding. And the biggest thing I'd just like to indicate here is that from 2017 through 2020, our blend of rapid rehousing versus permanent supportive housing drastically changed. We have a lot more rapid rehousing within our portfolio, a lot less transitional housing that we have in our portfolio. So I think that that's probably one of the primary drivers of this. We saw, effectively no change from 2019 to 2020, but we are seeing that desired trend of people increasing their income, specifically earned income in our housing projects. The last slide that I have around system performance looks at non-employment income. So it's that same population of people, continuum of care funded projects showing an increase in non-employment income, showing that increase as well. Last slide that I have for you for consideration is a summary of a document that HUD has made available to continuums of care called the System Improvement Opportunity Briefs. It basically is a document from HUD that outlines each of the individual system performance measures and the ideas that a community could look at to strategize to ensure that that system performance measure is getting addressed. So for example, one of the items that was identified within our system performance metrics was that our length of stay in shelter has not changed. So if we looked at the brief area, ensuring that homelessness is brief, they would encourage us to look at ideas of increasing rapid rehousing and specifically taking some rapid rehousing projects, rapid rehousing dollars and targeting long-term stayers. Regardless of vulnerability, persons that stay in shelter a really long time are going to kind of log jam and prevent the flow of additional people through those beds. So if you have a person that is staying 200 days when the average is 100, that could have been 2 or 3 people that would have been served in that same amount of time. There are a number of strategies. Each of these are really just here to inspire and to remember that strategies, when implemented, really should be drawn back to system performance and hopefully back to items that will be able to improve our system and improve our ability to retain funding. So that's the presentation that I have today. I'm happy to field any questions. Thank you so much.
Oh, sorry, Ryan, you're on mute.
Sorry about that.
No
I was saying thank you so much, Ty. That was so informative and really interesting, actually. Are there any questions or comments from other board members? Sam.
Yes, Samantha Jackson. Ty, this is fantastic work. So kudos to you and your organization and your team. Really phenomenal. You had mentioned that brief. Is that something that you're able to share with us as well? Or is that something that MAG staff has that can be shared with the board?
I'll make sure to find that and add it into the link in the chat room here, but I'll make sure that MAG has that document to make it available.
Thank you.
Thanks, Sam. Are there any other comments or questions from the board?
Ty, you mentioned the media story that talked about 25% people, and you said that it took to 2 years combined, but each year looked lower than it looked 20 or 18%. How did they?
Yep, so the media story that came out last week, it was front page of Arizona Republic, identified that 25% of persons that were previously housed within the HMIS system returned to homelessness within 2 years. So this particular, that's looking only at the 2020 data point. This 18% represents the 1 year measure, so 365 days. And that media story looked at the 2 year measure, the 720 days. So in this particular chart, that isn't represented at all. It doesn't show any of the 2 year data. This is all plotted 1 year data. So if we were to look at the 2019 data point, it would be higher than 20%. If you do look in the board materials, there is a chart that discusses the returns to homelessness rates, and you'll see that 25% metric right down at the bottom right-hand corner.
Thank you.
Yes, Bruce.
Hi, this is Ryan. Can you tell us how we compare to other communities of our size or similar types of systems or cities, regions?
So that is something that is probably a presentation all on its own, is being able to do a comparison between communities. What I would say is that there is publicly available data for 2017 through 2019, and there isn't data yet published on the 2020 data points. I would say for most of the measures, we fall, HUD breaks down the continuums of care into geographic sizes. So they have small cities and then urban large cities. When you filter to say just for the large city cohorts, we generally fall median or above for a lot of these measures, which definitely is encouraging. I think the piece that is important is that as HUD evaluates system performance, they're not doing a comparative between organizations. They aren't looking to see how do we compare with LA or with Las Vegas. They say, how do you compare with yourself? And so they're looking specifically, how are you following your trends? Are you and your system actually reducing length of stay? So I haven't seen any metrics from a HUD perspective where they're doing comparative analysis and system performance between communities, but they definitely expect that a community themselves, once they establish baseline measures, that you see reductions or improvements in those different areas. There are a number of private communities that have tried to map out those data points. I'll be sure to share that in the chat as well, where you can see all of the continuums of care mapped out for all of the different metrics. to do an analysis on that really would be an entirely different presentation.
All right. I appreciate that, Ty. I was specifically wondering about on the returns to homelessness item, but I can see that it would really matter. It would really matter what your city was like, what your system was like, where you are in terms of different initiatives. So I appreciate the point about comparing yourself to yourself and improving what you can in your own system. I did see Eric, you had a hand up earlier, and Joan, I see you have your hand up. So maybe Eric and then Joan.
I'm going to go ahead and pass. Go ahead, Joe.
Okay. Joan?
Yep. Ty, would you mind advancing the screen a couple of slides? It was the HUD suggested. Yes, this one. I just want to kind of, what's the word? Like, I want to sit with this for a bit. So thank you for doing that. That's all I really wanted.
My pleasure. I think the piece I would add here is this strategy document is a couple of years old. I definitely appreciate all of the work that our community is doing and trying to investigate not only these types of strategies, but many different types of strategies, and ensuring that the strategies that we come up with do relate back to individual performance measures that we can evaluate our system with.
Well, again, I really appreciate this, Ty. It's really important for us to look at our system performance measures regularly. So I appreciate this update. If there isn't anything else from the board,
I have one thing.
Oh, please.
Sorry, mine's more of just like a comment, because I understand about the returns and some of these performance measures being required by HUD, but looking at the 1 year look back for returns just feels like erroneous to me. I don't know if I can't think of a better word, because we've seen in the veteran space, and I believe veteran space is a microcosm of our entire system, most of the folks that are returning, it's between 2 and 5 years, and it's a lot of returns. And so I think if we're serious about really wanting to improve our system, we have to pay attention to things that are happening beyond what HUD requires for system performance and looking at that. Because we did see a lot of people that had been cycling in and out for many years. And how do we get people to actually stabilize? That's all I was going to say.
Well, on that note, Ty, is that something that we can easily calculate for ourselves and include it to one of our measurements?
Yeah, there's nothing preventing us from doing a larger cohort study. I think the hardest part about this system performance measure as it exists right now, if I go back to it, the first thing to note is over on the left-hand side here, it shows the exit time frame. So the analysis for the 2020 data are people that exited starting in October of 2017. So like this is an exceptionally lagging measure. So if we were to do this for a 5-year cohort, we'd be looking at, so this is only 2 years. So if we wanted to do exits from homelessness, we'd be looking at people that were exiting in 2014, right? So it's certainly possible to do. It's just data that we haven't pulled before. So we could discuss, I think the proper approach to that would be to discuss that applicant, the HMIS lead, kind of determine the prioritization of that type of data request and like what we'd really be looking for from that type of cohorted study. Because a lot of times it's really hard to come up with strategic interventions for things that are, 5 years out, right? Like 5 years running, especially when we even look at the 6-month metrics and we see that those numbers are really high. So I think what I share now is that, yes, that data is available. There's nothing that is proprietary about looking at this data from only a 2-year perspective. So if there were a desire to include a 5-year metric as a system indicator, that's something that could be done.
I personally would be really interested in that. And same if there's like certain programs that just perform a lot better than others, where their rate of retention is a lot higher. Maybe there's some sort of iteration that we can try to promote with it among the different providers. Or maybe if one provider is just serving way harder to serve populations than others, or what the reasons for that is.
I hear what you're saying in terms of wanting to focus on, if we're losing people at 6 months, obviously we need to focus on that first. But I think the better we get at that, then the deeper dive we need to make towards those lengthier times out, because, you know, the investment that we're making for every single person is, you know, deep, and we want to make sure that it's a long lasting investment and that we don't have to revisit it anywhere down the line. But I understand the need to look at our, you know, the people that are falling out quickly. And that's another good point, Tamara, is maybe based on the type of intervention or the level of acuity or other dynamics, maybe certain types of situations are collapsing sooner than others. And maybe I'm hoping, I guess I should say, that at some point we can dive a little deeper into that when it's the appropriate time. That'd be great. But this is great, giving us this kind of insight leads us quickly to these conversations that get us to the point of, you know, where we really need to look to improve our system. So I'm really happy to hear this presentation. Sam?
Ryan, yeah, can I just add 2 more quick questions for Ty? One is, can we use these same metrics and tie them to our racial equity work? And then when we're tracking housing exits, are we also tracking diversion exits?
Great question. So the first point of being able to track this along with the race equity conversation, yes, that is definitely something that the MAG team and the CRN team are actively working together on to prioritize those types of requests. We're going to be starting with our Built for Zero dashboards. That data has a lot more live data and is going to be very actionable quickly. And included in that does have a returns to homelessness sort of measure in it, those that are entering homelessness that have been housed previously. So we'd be able to have a little bit more live data. So that's the current strategy that we're thinking, at least in terms of getting something out quickly. In terms of tracking diversions, the piece that I would say is that we really haven't had a lot of clear guidance from HUD around how to track diversions. So we've been doing things locally to be able to track those diversions through our coordinated entry processes. But we do not have a mechanism that we've rolled out kind of system-wide diversion for an emergency shelter to track a diversion or to track a rapid resolution. Those are metrics that are a little bit more nuanced and haven't been standardized across our community. So I do believe that we could do a presentation on diversions through coordinated entry, but not the type of system-wide diversion that we typically have that is happening across multiple different providers and sectors.
I'm back, Ryan. I do have a quick question or a comment, actually. Thanks. I mean, I think the good news, the housing exits from shelter number, it's a significant increase, it looks like, 42 to 48%, and is where we want the trend. I guess the alarming thing that I see that we haven't talked about as much is just the length of time in shelter. And we've known that was a concern for a couple of years, and I mean, this doesn't reflect us seeing much improvement there. So I guess my comment is just to keep that in front of us. I know it's been the subject of a lot of shelter, particularly, it's been the subject of a lot of the conversation in the regional planning work as well. But that's just I guess that's where my alarm bells kind of went off. Was going from 95 to 103 seems like a pretty big jump.
If you would want me to interject, I would say that from a continuum of care funding perspective, this is probably one of the hardest measures to hit by itself. You know, the things that the continuum of care can do is prioritize, but the prioritization matrix that HUD really encourages and from a lot of different communities makes a lot of sense is around focusing on those most vulnerable, those that are vulnerable, those that are vulnerable from homelessness. There's lots of reasons that is the approach that we should take. But the result of that is that you do have long stayers in the shelter that don't meet a particular prioritization criteria. And that is what we are finding, that there are a lot of people that are lower acuity rating lower on the VI Stat Act, people that are able to have some type of income, but not enough income to support them being able to move out of the shelters. So I don't want to speak too definitively. We have done presentations on that, and we could do a more in-depth presentation. But certainly there's a lot of factors that play into this, and these are program types that the Continuum of Care does not directly fund through Continuum of Care dollars. So it requires a different type of strategic partnership.
Thanks, Ty. Appreciate it.
This is Liz too. I'm sorry I was late. I was ending another meeting, but thank you so much, Ty. I can't believe I missed the majority of this presentation, so I was looking forward to very much. I think on this though, for length of time in shelter, this is something within our board strategic planning where we really talk to standardizing the shelter protocol so that we can try to bring additional resources so that there is the right level of case management at each of the shelters. The moment someone enters into the shelter, they get their housing assessment done. They get to a medical doctor. Like all of these standardized kind of things are in place so that we can make sure that we are trying to help move people through shelters, but most importantly, using the time that they're there to make sure we get all those interventions in place. This is great, Ty. Thank you.
I appreciate everyone's comments so much. I think it's important to, especially on this length of time in shelter piece, that we don't put it all on our shelters. I mean, we have an affordable housing crisis. And a housing market that doesn't allow for people with any kind of barriers or history or past of any kind. So I mean, I think regardless of whether the responses are COC funded or not, I think our board, especially in our strategic planning, have made it, and you'll be hearing more about that over time, made it very clear that if we're going to solve this problem, we need to be looking at all of the solutions and partnering with everyone in our community that has a stake in it. And the housing sector is most certainly one of them. So great discussion. If there isn't anything else, I'm going to move us right along. And seeing no hands from anyone, thanks again so much, Ty. I appreciate you so much for being here and all the time. Our next item, I'd like to introduce Maggie Wong, Research Analyst at MAG. She will demonstrate a new interactive mapping tool for the COC board's input. The Homelessness Assets Map is being developed through a partnership among Crisis Response Network, 211 Arizona, the Maricopa Regional Continuum of Care, and the Maricopa Association of Governments. So Maggie?
Thank you, Madam Chair. Can you guys all see my screen?
Yep, it's a little hard to hear you, Maggie.
Oh, is
maybe
this
just
better?
turn up your volume. Yes, thank you so much.
Okay, I'll hold it up like this. Well, good afternoon, everyone. My name is Maggie Wong. I'm a research analyst at MAG in the Regional Analytics Division. So yeah, as was mentioned, I'll be sharing an update on this Homelessness Asset Map. So we've presented this tool at the Data Subcommittee and COC Committee for feedback, and sent it out to the general COC email list as well. So hopefully some of you has had the chance to check it out. But yeah, so as was mentioned before as well, this is an interactive mapping tool that we've recently developed in partnership with CRN, 211 Arizona, and the COC. Data comes directly from the 211 Arizona resource directory. So we identified services that target or frequently serve populations experiencing homelessness. And then it also includes preliminary data from the HIC, which is the housing inventory count that we submit to HUD annually. And that shows all shelter and housing programs in the region. Do want to note that we are not mapping confidential locations, such as most domestic violence shelters. And yeah, the purpose of this tool is really to visualize spatially where services and programs are located across the Maricopa County region for better regional planning and coordination. Currently, it is not meant to be used as a resource for housing, so it will not be a public client-facing tool right away. For now, it's mainly meant to assist planners, providers, and stakeholders in collaborative planning and policy development. So this will end up as a password-protected website for now, and we'll keep you all updated on that information as we are developing it. Part of that comes from a concern that was raised at some of our previous meetings from providers that clients really need to be walked through how to access housing and services in our region because we have a coordinated entry system and a prioritization process rather than simply showing up to an office requesting housing. So we don't want this map to encourage that without the proper messaging. So that's something we'll look into as we develop it kind of in a phase 2 or 3. And before I jump into a demo, just want to note that this is still a work in progress. We're reviewing and incorporating feedback as we speak. So right now, what I'm going to show you is really a draft mode that was primarily to get stakeholder input on the data itself, as well as general features and usability. So the design and layout most likely will change as we add more features. So now I'll go into a quick overview of this draft tool. So as you can see, this initial view shows just the Maricopa County region with all these icons here. We've got a welcome pop-up that kind of walks you through the different parts of the interactive map. Pretty simple, just showing the different features that are available. And that's a tutorial that you can skip or you can re-access by clicking the help button at the top right. We've got this about section that explains the background and data sources, similar to what I mentioned before, along with some contact information for MAG as well as for CRN 211 if anyone has any questions or feedback. All right, so as you can see, there's a variety of icons here. So in the legend, we've got kind of this selection of general categories that we've grouped program types into. So we've got shelter, housing, food and meals, healthcare, clothing and hygiene, other services, and ancillary service. And you'll see there's a little info button you can hover over to kind of look at the specific program types within each of these categories. And you can also toggle them on and off. So for example, if we just wanted to look at shelter and housing programs, you can just kind of toggle those right there. At the top, we also have 3 filters. One is for program type. So this is for specific programs. So say you just wanted to look at emergency shelters, you could select that at this filter. You can also filter it by city and then also by provider. And these filters may be improved on. We really just had these initially for easier review as providers look at it and see what programs are listed or what programs might be missing. And now just to show you kind of what the data on the map looks like. So for example, I've clicked here kind of in the Human Services Campus area. In the pop-up, we've got the program name, the address, housing type, units, and beds. So this one is coming from the HIC. But for programs that came from 211, we definitely have a lot more information available from that resource directory. We've got hours, we've got a pretty extensive description, eligibility, and more. So we're always looking into how we can improve and add more fields like these to be more useful. And then you may also notice we've got these blue buttons to submit feedback. As mentioned before, that's the primary purpose of the tool right now because we want to make sure the data is accurate. So right here in the pop-up, you can submit feedback for a specific program that is already on the map by leaving a comment and contact information. Or if you've already looked at the map and you see that something is missing, you can add a location by clicking on the Add Program Location button right in the legend. And it'll prompt you to include kind of all these basic fields along with an address so that we can make sure it's mapped properly and any additional information you want to provide. So we've received a lot of feedback through the tool itself as well as through emails. Really grateful for those and looking for those. As mentioned before, we are still looking to add more features to this as we develop it into a more comprehensive planning tool. So we're thinking of adding base layers of point-in-time PIT count data, outreach concentration data, basically to help us understand where are we encountering more folks experiencing homelessness, and are there areas that could use more targeted services and programs. We're also looking to bring in contextual layers such as demographics from the census. We can look at poverty, age, vulnerability, a number of fields, and we're really open to any input you all may have on that. So overall, we really just want this to be a useful tool for planning. We're reviewing this for feedback. It's probably going to take us a week or two. The MAG and CRN 211 team is really carefully reviewing and updating the data to make sure that we have consistency between all the different data sources. And making sure that we have the appropriate changes. So I just want to thank everyone who has submitted feedback and reviewed the tool. I'm really grateful for the input we received on how to better visualize things as well. And with that, I'll just open it up to any questions and feedback that the board may have. Thank you very much.
Maggie, this is incredible. Thank you so much for that. I know you said it's not going to be released to the public just yet, but is there a plan in the future to maybe have this be public facing and have real-time data? So if somebody wanted to look on here and see if there was somewhat like a program that was available or something like that.
So that's an interesting piece you bring in about the real time. That's something we actually haven't discussed yet. I think that would take a lot of coordination, but we can certainly discuss it. As mentioned before, so phase 1 of this, it'll be password protected for providers and planners. Phase 2, we'd love to discuss with the COC community how we can appropriately message this so it becomes a public client facing tool. That really extensively explains the coordinated entry process, includes numbers they need to call to enter the system. And then, down the line, if we're able to get real-time data, that'd be really cool to add as well. So thanks for that suggestion.
Maggie, where will this tool, what's the timeline for completing this tool and where will it be available?
So we'll have a link that's, it's probably going to be hosted on a MAG website since it's an interactive map tool, but it can be linked to from anywhere. We'll share the link when it's available. Timeline, we're hoping to have, a close to final version by the end of April, maybe early May. So we'll definitely keep the board updated and return with any updates that we have. And I can drop a link to the current draft tool in the chat as well, just in case anyone wants to take a look.
Thanks so much, Maggie. Oh, Sam?
Yeah, just one quick question. Maggie, on that password protected piece of it, are there any exclusions that would stop somebody from who's going to approve, I guess, access to the system?
That's something we're going to discuss. I don't have any specific details on that yet. I imagine it'd be something that the MAG team and CRN 211 team, along with input from the COC, decides. But really, the purpose of the password is so that it's not just open to the general public. But I think that we'd be pretty open to sharing the password amongst the COC.
Well, thanks again. I know I played around in it in a little bit, adding some things and sending you guys some comments, and it was really user friendly and intuitive. So I appreciate it. It's a lot of fun. It's a great new tool for us. So thank you guys so much for working on that.
Thank you. Yeah, feel free to submit any other feedback you have if you think of it. Thank you.
Thank you, Maggie. All right, moving on to item 7, notice of funding availability. Julie Montoya, Human Services Planner at MAG, will lead a brief discussion on the planning for the 2021 HUD Continuum of Care Notice of Funding Availability, or NOFA, which is expected to occur in late spring, early summer. Julie will provide an update on the NOFA timeline for discussion and how the board would like to update the review, rank, and reallocation process, and the scorecard used to evaluate new and existing project applications. Board input to implement strategic prioritization for key needs and gaps in the community, as well as key services desired, is instrumental to the process. I know this is one of our favorite topics, so thanks, Julie, for being here to present it.
Thank you so much, Madam Chairwoman and members of the board. As you are aware, the 2020 COC NOFA competition was canceled last year and an automatic renewal of existing programs occurred. Earlier this year, HUD did inform us that they do intend to conduct a regular competition for the 2021 COC NOFA, and we do expect that that announcement will occur in the late spring or early summer. Per board approval, we have contracted again with Homebase to provide assistance with the program evaluation process of new and renewal applicants. And the goal is to have all evaluation tools completed by the end of April. In May, we do begin communication with renewal projects to start their initial evaluation process in preparation for the NOFA announcement. In your packets, I do believe that you have the most recent board-approved review, rank, and reallocation process. And it also looks like it's up on the screen. This document lays out the entire objective evaluation process that occurred during the last annual Maricopa COC competition. In addition, the scorecard, which is also in your packet, was reviewed and revised last summer by a COC board ad hoc work group. Changes were made mostly around the first 3 scoring metrics, and at that time, due to the COVID pandemic response, it was agreed that not too many changes should be made, and it would be relooked at the following year, including adding additional metrics on racial equity. Another part of the board's role in this process will be to identify key needs and gaps in our community, and in turn prioritize the key services that the board desires to fund. So today, MAG staff would ask the board for a discussion around the need for an ad hoc working group to look at the scorecard for any possible new revisions, or if the board is happy with the scorecard as is, MAG staff, along with the racial equity leadership team, could identify and propose specific race equity metrics for approval at the next board meeting. As part of the discussion today, MAG staff would also ask the board what information you need from us to help you make an informed decision on what funding services should be prioritized for this year's funding competition. Thank you for your time today. That concludes my update on this year's COC NOFA. I'd be happy to open it up for discussion or answer any questions.
Thanks, Julie. I'm absolutely certain that there are questions or comments from the board. Don't prove me wrong, people. Sam?
Do we need then to take a look at the proposed ad hoc committee, or whether it would just be easier to work through the race equity group? I know there's a lot of changes, I think, that wanted to come from race equity and that side of it, but I'm wondering if there are some other measures that need to be looked at as well that would kind of fall outside of the race equity, which to me would be a reason to have an ad hoc.
And for clarification, the board working group did work on this. I believe it was last August, and did make, the changes that they felt needed at that time. So depending on those that did work on it, and it did get approved through the board, through the entire board, if you all felt that it needed more work and more revisions, that would be up to you all to decide.
This is Jackie.
Sorry.
No, go ahead, Eric.
Oh, thanks, Jackie. Sorry, I didn't know if you could hear me. Yeah, I was on that ad hoc in the fall, and I can't recall all of the issues that were raised, but I think we kind of we kind of reached an agreement that we would look at, there were certain things we could change for last year, knowing that it was a weird year, but there were more things we'd like to look at in an overhaul. So it strikes me that it would make sense to do an ad hoc committee with the racial equity working group as well.
I agree.
This is Jackie. I agree also about an ad hoc group, and I'm wondering, let me rephrase that. I think there's definitely a place for the data subcommittee to participate in these discussions as well.
Is it my understanding, staff, that we already have an ad hoc group prepared to work on this, or would we be reconstituting an ad hoc group to work at this?
Well, last year it just consisted of board members. So if you all did want to bring in other members from other subcommittees or committee, we would have to work around that.
Okay. And what's the timeline, Julie, that you would need a decision made by? Not a decision about the ad hoc group, but about when do you need the work of the group to be completed?
The goal is to be able to finalize the scorecard by the end of April. So, hoping to get it approved by the April board meeting so that we can really dive into the renewal application evaluation process in May. That's the goal.
Okay. It seems like maybe since we're a year away from having looked at that, I remember Dee Dee feeling very strongly last year about this and putting that lens of racial equity on top of it. And because of everything that happened, I'm not sure honestly if that got completed. Did that get completed?
No, since we didn't have a competition, what initially was discussed that if we ended up having a competition last year, that it would have been part of the interview in-person
That's
process
right.
and
Yeah.
not part of the scorecard, which could still occur if that's what, what the board decided on, but that was what was initially discussed.
If the board would entertain it, I wouldn't mind seeing just a couple members, and if you want to include members of the subcommittees, I think that's great too. Just giving it at least a once over look to make sure that we don't have any additional questions and that we're still thinking the same way we did last year. It's just been a bit of time, and I think we should at least give it a review before it goes before the board in April. How do others feel about that?
I agree. And if there's, you were cutting out from my end. If there is the ability to bring in other folks beyond just the board, I think that would be great. But I know we're always under a time crunch.
Yeah. Julie, does that seem like a reasonable task to ask you guys to pull together a couple of board members and maybe a representative each subcommittee, like the data, maybe coordinated entry, racial equity, and the committee, to just do a once over of it and bring a new recommendation forward to the board in April?
I think that's completely doable.
Okay. All right. Might I have a motion to that effect?
This is Jackie. I would make that motion.
Thanks, Jackie.
It's Eric. I'll second it.
Thanks, Eric. Okay, so we have a first from Jackie and a second from Eric. I'm going to ask Sarah to take a roll call vote, please. And if you can just remember to do your ayes and nays, that would be great.
Thank you so much, Ryan. We'll start with you, Co-Chair Ryan Balch.
Aye.
Thank you. Eric Cole.
Aye.
Thank you. Elizabeth DaCosta.
Aye.
Thank you. Marshall Franklin. Tad Gary. Tad Gary. Samantha Jackson.
Aye.
Thank you. Bruce Liggett.
Aye.
Thank you. Joan Service. Aye. Thank you. Charles Sullivan.
Aye.
Thank you. Jackie Taylor.
Aye.
Thank you. And our other co-chair, Tamara Wright.
Aye.
The motion passes. Thank you very much.
Thanks so much, Sarah. And I was, and everybody, I was so excited to get to item 7 that I skipped item 6. My sincere apologies. So we do want to go back to item 6, which is to discuss our draft regional homelessness strategies. And give me 1 second. I think part of this is that my papers are now out of order. There we go. So I'd like to introduce Nika Rapkin, Executive Director with the National Consultant Homebase, who will provide a presentation on the proposed regional homelessness strategies. The strategies are organized into 5 categories: shelter, services, prevention and diversion, coordination, and housing. The COC board will have an opportunity to provide direction on the regional efforts underway, including the draft regional strategies. Please refer to your enclosed material. Nika, I so apologize for skipping over you. That in no way reflects on how excited we are to hear your presentation and have you here today.
Oh, not at all. It's been a pleasure sitting in on this meeting and hearing everything that's going on, and it's all been tied into the work we're doing. So this has been fantastic.
Thank you.
It's great to meet you all. For those of you that we haven't had an opportunity to connect with, and it's been just a real pleasure working with everybody over the last few weeks and working closely with the strategy team to take this forward. I imagine there's been conversations about this in various quarters, so I don't want to repeat too many things that folks have heard already. And I know that it's a brief agenda, so I'll move relatively quickly through this, but please don't hesitate to stop me if you've got questions along the way. what I was hoping to talk about was just briefly giving an overview of the goals of the process, some of the work that we've done to date, and what things are starting to look like in terms of trends and emerging priorities. So we can go to the next slide. The strategy team has put together a mission for this process, which really articulates the heart and soul of what folks are seeking to accomplish with this. In short, the goal is to catalyze implementation of a set of prioritized, sustainable strategies that can be implemented across the region that are housing focused, center racial equity, focus on bringing in and meaningfully incorporating feedback from people with lived experience. We can go to the next slide. So as mentioned, there's 5 categories. At this point, there are over 40 different strategies that have been analyzed, and or there's been research that's taken place on them. So it's a very, very robust foundation. And the goal, the next steps have been looking at the kind of data and information we have to figure out which of those 40 are rising to the top in terms of the most urgent priorities. I want to talk a little bit about some of the data that's been looked at as part of that process. So we can skip to the next slide and possibly the one after that, next one. So there's been 2 major components to the data work that's been done. The first has been a very, very robust and intensive process of stakeholder engagement that's been taking place over many, many weeks. There's been almost 600 surveys, multiple key stakeholder interviews, and a number of stakeholder forums with a variety of different kinds of stakeholders in the community. And from each of those conversations, there's been detailed notes, and so that's all been integrated as part of the process of the review that we've been doing. The next 2 slides, which we can flip through now, is the list of materials we've been essentially taking several years now of research and analysis and reports. There's a gaps analysis in 2018, the very recent racial equity analysis, and everything in between that's looked at strengths and opportunities for improving the systems here, for improving housing outcomes, for improving equity. And you can skip to the next slide. So what we've done has been taking all of the feedback from those stakeholder sessions and all of the information from all of these resources and pulling out the key information that's needed in order to be able to filter through and prioritize which of those 40 strategies are the most urgent, which ones come next, and so forth. So we can go to the next slide. So the next slide shows just a few, there's quite a lot of information, obviously, from all of these different resources, but there's been some trends that have definitely been emerging in terms of particularly relevant, salient points. And I appreciate that this is following the system performance measure discussion, because these areas are so deeply intertwined. And the asset mapping, actually, this couldn't be more perfect. So one of the bottom lines is that homelessness is continuing to increase locally and with great disparities across race, with African Americans almost 4 times more likely to be experiencing homelessness and Native Americans twice as likely. The rate of chronic homelessness is increasing, but the number of available permanent supportive housing is not in a way that can match the need. There were an increasing number of people who are unsheltered. The rates of unsheltered homelessness are significantly growing at rates much greater than the sheltered count. I bet will come as a surprise to nobody, but hot off the press is the GAPS report that talks about housing nationally, and there's a severe shortage of housing for people who are extremely low income in the community. A lot of households at risk of falling into homelessness. And this is, again, one of the interesting things of looking at this data is sort of most of it is pre-COVID. So we know that a lot of these issues, without necessarily having good data on it, we know that a lot of these issues are going to be exacerbated, especially as things continue to move forward around when the eviction moratoria are eventually taken away. And but even at that point, when this housing market analysis was done, 35% of households were reporting housing insecurity. As you'll see in the 2018 gaps analysis, a lot of those challenges that were identified there still continue to hold true. There's pretty significant rates of folks exiting rapid rehousing to non-permanent housing situations, and the equity report indicated that people of color are significantly more likely to return to homelessness from supportive housing interventions. The next slide shows a little bit of, in terms of trends of some of the feedback. Again, probably none of this is super surprising to any of the folks here, but they've been the things that have really been rising at the top from this review. The need for more regional dispersal of housing infrastructure, shelters, and resources. That services are really congregated in Phoenix and some other communities like Mesa. A general lack of supportive housing options, particularly as needed to match the magnitude of local need. A need for geographically dispersed low barrier shelters around the community. That's been hearing that over and over and over again. How much people would value a more regional network of small shelters, and that it takes too long to house people in rapid rehousing, that it's not rapid enough. And as a result, people, while they may be eligible and matched and ready to go with a supportive housing resource, they're still experiencing sometimes unsheltered homelessness because you can't get them into a housing solution quickly enough and to support them in utilizing that resource. A lot of the it's come up a lot already in the conversation today. There's a strong vested local interest in addressing the systemic racial inequities and also in doing more to incorporate people with lived experience of homelessness into the processes and decision making and program design and implementation that's happening. A vested interest in strengthening coordination and partnerships. There's a lot of desire for more coordination, for more wraparound services, and to bring together all of the good work that's already happening locally to be building off of each other in order to advance something that's regional in impact and really sustainable in its scope. And then also addressing public misconceptions about homelessness and its solution, and trying to get everybody in the same page in terms of buy-in, and so that these solutions can actively move forward and make meaningful impact, especially as you've got resources coming into the community that are related to COVID and other opportunities that are really coming to the fore. And then prevention of homelessness has been a hot topic, again, particularly with the COVID-19 challenges and opportunities. So the desire to systematize and integrate diversion, which I know we've already spent some good time talking about today, and also taking steps to prevent what, when you're very anxious about what the impacts are going to be around homelessness in the future as the COVID-19 impacts continue to become known. So those are some of the areas of feedback that community-wide have been rising to the top. Let's go to the next slide. So based on that, and there have been 14 strategies that have been identified as the most urgent. And of the 40 strategies, the idea is that none of them necessarily go away. There's a few that maybe aren't great fit, but a lot of them are really meaningful strategies. And so the question is, what do we do now versus what do we do next versus what do we do a little bit later? And in terms of the areas that have been meeting with the most urgency, they're because it's the right time in the right place and people are going to be bought into taking this forward, or the resources are there, or it's fundamental to making sure that other things can happen that are going to be crucial to really reducing homelessness locally and improving the system performance. We've got creating a coordinated investment plan that's housing focused with the COVID-19 funds that are coming in. strengthening and coordinating and building out landlord engagement work. There's some really great stuff that's already happening, but building on that to have it really be truly regional and impactful as much as possible. Building out a flexible housing pool to expedite people's ability to use permanent housing resources and their homelessness, and increasing affordable housing development. Partnerships and advocacy, and what's going to be really needed in order to address some of those challenges around the shortage of ELI housing. For coordination, engagement of people with lived experience of homelessness, especially people of color in decision-making roles, and feedback loops as this system continues to be developed and implemented. Doing deep dives on data to continue to understand and respond to equity disparities. Strengthening the capacity of our programs and services and systems to implement the work in an anti-racist way. Build multi-sector relationships and coordination across all of those different systems. Child welfare, the school districts, criminal justice, law enforcement, all of those key partners in the communities, locally in the community. Coordinated entry evaluation and redesign. Sorry, print is really teeny tiny on my screen. So taking a deep dive on the coordinated entry system and looking at where that has the opportunity to be strengthened as far as speeding up resource allocation. And these are some things that can really tie into impacting the system performance measures. Reducing the length of time that people are homeless, reducing returns to homelessness, and so forth. Employment services and supporting, leveraging more of the local opportunities for getting people connected to workforce in a system coordinated regional way. We talked about the response to unsheltered homelessness and the desire to have geographically dispersed small shelters and an overall coordinated response to unsheltered homelessness. An increase in bridge housing, which goes to comments that we're really hearing about rapid rehousing and some of those other interventions not being able to be used quickly enough. So people residing in places not meant for human habitation in the meantime while they try to find a unit. And then adding deepening the diversion and prevention work. That is, some of which is already happening here, but again, building that out, systematizing it, and making it regional. So those were the 14 strategies through the filter of all of the information and data that's been coming out and on the review of all of those materials. One last slide that I'll just mention real quick. The next steps is to finalize these priorities. Are they the right priorities? Are there things that need to be modified or changed? And then in June, there's an implementation kickoff and then continued processes. Also a strategic planning process in the fall focusing on subpopulations. So a lot of next steps once those priorities are identified to really accelerate impact and implementation across the region, and additional planning, of course. That's everything that I had. Very happy to answer any questions, and also for the folks who are on the strategy team who are part of this call, please feel free to weigh in on anything important that I may have missed.
Thank you so much, Nika. What a great presentation. Comments from the board? Sam.
I feel like I have so many questions today, so I apologize because I'm not trying to take over the meeting. This is, again, it's amazing information. One of the things that, well, two things that I'm wondering about. One, are we tracking on municipal strategies? Because I know the City of Phoenix has a strategies plan. I think Tempe has a new strategies plan. I haven't been following all of the cities around the valley, but I'm wondering if MAG staff or maybe it's the regional collaborative that are tracking on some of these changes. And then my second question, did transportation come up as one of the 40 strategies listed within the program? Because one of the things I'm concerned about is as you start to kind of have greater regional shelter, making sure that there's good transportation to those shelters, and people are able to kind of get to appointments and things like that from those places, job opportunities, et cetera.
Oh, yes, the regional strategies are being tracked. They're part of one of the key pieces of information in the portfolio is what all folks are doing, or all of the individual municipalities, their respective plans, and so what they're doing or planning on doing. So some of those priorities are creating new stuff or creating it regionally, and some of it is more building on the backbone that's already being created by some of the municipalities that are carrying this forward. The transportation question is a great one. That, as I recall, didn't come up as a strategy on its own, but a lot of the strategies and the way that the regionalism aspect of this is being talked about is to really try to make these resources more accessible to people who are in all sorts of various parts of the continuum of care. So it makes sense to be looking at that as a piece of each of these strategies to ensure that the end goal of each of these pieces is accessible to folks no matter where they're presenting geographically.
Madam Chair, may I jump in as well?
Oh, please, Amy.
Great, thank you so much. And so yes, absolutely. We collected more than 300 different local strategies, and that actually was a genesis, the foundation that we've used to build this regional approach. And so more than 300 different strategies from the approved plans, priorities, action steps that our local cities, towns, counties, Native nations are taking right now. So it's absolutely the foundation for it. In terms of transportation, so Nick is exactly correct. It's not a separate strategy, but it's an integral part of just about every strategy in there. It comes up, I think, at every single forum, comes up very often in different conversations, different meetings. The ability of people to be able to access, food, shelter services, medical care, school, all of that is really linked to transportation. And so we're looking very intently, and that's part of the reason for developing the Homelessness Assets Map, because we want to visually show where all of these services, housing, shelter programs are, but then also visually demonstrate where the population concentrations are of people needing these services, whether they're experiencing homelessness right now, or they will likely need these services and assistance so they do not experience homelessness in the very near future. And so being able to visually represent that data is particularly important so we can check the transportation, because we don't want to site a new shelter, for example, if it's not close at all to other services and assistance. Or if we're going to do that, then we absolutely need to make sure we have robust transportation services in place to literally bridge that gap. So transportation is very much a focus on all of this, just to make sure that people can access the programs that are being made available right now. Thank you.
Thank you, Amy. Other comments?
Yeah, it's Eric. I am sitting on these strategy and coordination meetings, and first of all, it's a great deal of information, and just so appreciative of everybody for corralling it and helping us have it in a digestible manner. I do think what's very cool about this process is that it has kind of live feedback, either through these ongoing different, conversations and sessions, or, and particularly valuable, I think, are the regional, the conversations and, directives that we're getting from the different city governments, right? And the different, that set of stakeholders who are kind of, giving us their perspective as well. I think, it's a kind of a feedback loop process right now, which I think is really positive. Knowing how much, that was a fantastic presentation, Nick. I really appreciate it. Knowing how much is in there, and I'm, if there's a way anybody has specific questions or follow up and needs help digging through it, I'm of course happy to do that, as a board representative also. but thanks to the team. It's great.
Thanks, Eric. Speaking of board members or others who have participated, can staff just give us a rundown of those folks so we can appreciate them?
Thank you so much, Ryan. And always eager to thank people and always terrified that I'm going to forget someone. So apologies in advance if I'm forgetting anyone. First, really want to thank Eric. He's been fantastic. He's really been at the forefront to help really shape these strategies and then get ready to share them out. We've been working very closely with the municipal human services directors as well as the staff from the cities and towns. So thank you to Ryan, to Marshall, to others who have been helping us out, really understand from the local perspective. We've been talking together with you about the where in this conversation is critically important. So it's really important to understand that the strategies will be implemented in communities. And so the community feedback has been critical. Also, thanks so much to Jackie Taylor and to other providers. Our very first forum was with the CEOs of the nonprofit forums, because we really wanted to embed this work in their deep expertise. And so Jackie was right there, and as well as a number of others who have been really helping to shape this work and to carry it through. From the regional collaborative, we've had Jason Matthews and Shanna Ellis also serving on the strategy team. And it's been wonderful to be able to leverage their expertise, their circles of influence. As you all probably know, the United Way just launched their 5-year strategic plan, and they're very focused on homelessness. So it really behooves us to be able to work together, to be able to leverage each other's efforts and amplify each other's impact. So that's been incredibly helpful. In terms of other board members, both you and Tamara have been fantastic with being able to just make sure that we're fully integrating the expertise of the board, and to really be able to work hand in glove with you as we develop these regional strategies that will be presented for your approval in May, and to make sure that this provides a good launching point for the Continuum of Care's regional plan to end homelessness, which we've talked about launching in the fall. And so really to make sure that the legwork that we're doing right now serves this greater purpose on a multiple fronts and moving forward. Also want to recognize Bruce Liggett with the county. He's really helped us to think regionally and figure out how does this work integrate with existing efforts, and to be able to provide different introductions and forums to be able that just to make sure that we're able to really fully coordinate this work with existing efforts and able to bring it farther as a result. So thanks so much to Bruce. And of course, the MAG team here, they're just knocking themselves out to serve you guys and to work really hard. So Sarah, Steve, Julie, Brandy, Tina, everybody has just been all hands on deck, really just incredibly digging in, nights, weekends, holidays, vacations. So want to recognize their efforts as well. And I'm positive I've forgotten someone, and if so, I am so sorry. This has truly been just a fantastic group effort with people just really pulling together in incredible ways. And our consultants, Nick and Julie from Homebase, Nikki Brookshire and Arianda Saunders from Corporation for Supportive Housing have been fantastic, and the groups over at Focus Strategies as well. They've just been fantastic. Kate Bristol and her whole team. They just completed their report on the siting considerations to keep in mind when you're launching new programs in your community. And we're so excited to be able to share that work with all of you as well. So we just got that in late on Friday, and we'll be turning that around by the end of this week. So thank you.
Thanks so much, Amy. And I thank you to everybody that Amy thanked on behalf of the board. So I know there's been a lot of, there's been several presentations and many opportunities for us all in our different capacities, whether we're human service professionals, or we work at a nonprofit agency, or we're part of an academic group, or whatever it is, to give input. But now that they're all formed and you have sort of like a draft report that you're working from to bring back to the board for approval in May, I believe, is there a place, or is there a draft plan that anyone in our community, any person who works at a provider, or person with lived experience, or just an interested resident or business owner or whatever, could actually go and see how what that draft looks like now? And is there like a time frame by which they could provide MAG input before that final draft plan is sort of put down on paper?
Absolutely. Great question, Madam Chair. Thank you so much for that. If so, anyone can go to azmag.gov, and if you click on programs and then homelessness, then there's a link for the regional strategies, and all finalized documents are posted right there. And it includes the iterative versions of those documents as well. So for example, we have the emerging strategies document posted on the MAG website right now. So anyone literally can go to it. We also do include our contact names and information. So anyone can view the work that's been done. Anyone can contact us with their thoughts, ideas, questions. We're happy to meet with anyone from the community who'd like to offer input to that, to this process. And really, the reason why we're presenting these prioritized strategies for review now is because we know that we need to dig more deeply, provide more data, provide more depth for every single one of these strategies. We don't want to do that until we vetted this with you and with the community. And so once we hear from you and from the community, yes, this is it, these are the action steps that we need to take right now as a region, then we're going to be going in and adding that additional data. So while we're saying that, okay, these are the strategies, that just means that this is the first draft for your review. And the ink won't dry until we've heard from a lot more people and we've had more opportunities to benefit from your expertise. And thank you to Sarah. She did put the link directly into the chat. Please go there often because we're weekly updating that.
Great, thank you so much. I just know there's so many people watching on YouTube or all the different ways that you can participate in this meeting now. And we don't get to see them or feel them or hear them, but I know they're out there and they're the ones in the trenches doing the work, worrying about these strategies every day. So I just want to encourage everybody to please take a minute when you have a minute to just read through them and share your thoughts with us. In the end, it's our community who will have to implement these strategies. So I want to make sure that they make sense and feel right to the community. So I just want to encourage everybody to look at those and get your feedback in.
Thank you so much. And we are reaching out to persons with lived experience as well. So if you go to that section of the MAG website, you will see a survey, and that has been sent out to our stakeholders and partners. But we appreciate anyone helping us to put that survey into the hands of people who are experiencing homelessness right now or who have, because we very much want to build these efforts on their feedback, but we'll need your help in getting those surveys back in. And we do want to thank Valley Metro because they have been helping out with that as well. And so it's very much, again, group effort, and I appreciate everyone chipping in.
Yeah, that's awesome. I see our outreach workers out there giving the survey every day, and folks are really glad to be participating. So I appreciate that as well.
Thank you.
Any other comments from the board before we move on to our next item? Okay, let me see if I can go in order this time. Okay, am I on item 8? Can I just get a yes from staff? Awesome.
Yes.
Okay, so this is a recommendation for a move on strategy ad hoc work group. So Stephanie Smith, supportive housing supervisor with Native American Connections, and our COC committee co-chair, Ann Tamara, is that correct?
No, she is the COC committee co-chair.
Oh, she's the committee co-chair. Perfect. I'm sorry, I messed that up. And our COC committee co-chair will present on a recommendation from the COC committee members about forming an ad hoc work group to address a move-on strategy for the Continuum. The move-on strategy is part of HUD's strategic priority to end homelessness and is in line with system performance measures for homelessness to be non-recurring. The goal of the ad hoc group is to increase the usage of move-on housing vouchers by re-energizing the conversation among providers and our public housing authorities. So Stephanie, I'm sorry I messed up your title. Thank you for co-chairing our committee, and I look forward to your presentation.
Thank you, Madam Co-Chair. Hello, members of the board. Like Ryan said, I'm here to present on recommendation from the board or from the committee for the board to approve an ad hoc committee to work on the move on strategy. I just wanted to give you a little bit of background on the work that has already been done. In late 2019, a lot of work was being done on the move on strategy, and and just kind of lost momentum and fell to the wayside as COVID came on. So last February, Sue Augustus and Micah Sneed from the Corporation for Supportive Housing presented to the COC committee about a move-on strategy and implementing it in the community. And if you recall, a little over a year ago was when COVID really started taking over our lives and demanding our attention. So where we left off is that we had an assessment tool that had been approved for COC funded programs to utilize the assessment tool if there was a client who wanted to move on from the unit or the subsidy that they were currently utilizing. And we also had memorandums of understanding in place with some different PHAs to set aside housing choice vouchers for these folks to utilize. So for instance, somebody in one of NAC's projects could apply for Section 8 housing choice voucher through City of Phoenix as one that was set aside for this move on strategy. They would qualify for that housing choice voucher, and then they would be able to choose their own apartment wherever they would like in the City of Phoenix, and they'd move on. What's important about this is that it creates some flow in our system. We don't always have a ton of new units coming on board that are supportive housing. We know that there's a lack of affordable housing in the county. So this is one strategy that we can use to open up some units in our supportive housing stock and create some flow through there. I can say that NAC, we did do a pilot of this. We identified 17 residents who had been housed at least 2 years at the time and would qualify. As of last month, 7 of those 17 have moved on, and they are all still successfully housed with their vouchers. Very happy and proud to say. And in the pilot time, ABC was also able to identify some long-term participants who would have been a good fit, but the participants chose not to participate. So that's kind of where we left off, is with that pilot project before COVID took over all of our lives. I know that was a quick snapshot, but happy to answer any questions or explain anything further to any board members.
Thanks so much, Stephanie. As you were talking, I was remembering, oh yeah, I remember that discussion now. So am I correct in thinking that your request is to get that group back together and see what you want your next steps to be, and then you'll be bringing that forward at some point? Is that about right?
Yeah, so if a board approves the ad hoc today, then we will determine who's going to participate at our next committee meeting. And our goal is really to re-energize that, to remind folks that those are available to use, and re-energize the conversation with the PHAs who already have MOUs in place, just to make sure they remember that they have those, they committed however many vouchers. That way, as we re-energize the conversation with housing providers and they make those referrals, that the housing authorities are aware of that. We're not catching anybody off guard with that.
Okay, great. Joan, I see you have your hand up. So polite.
Yeah, hi Stephanie, how are you?
Good, how are you?
Good, thanks. Hey, is one of the outcomes to present some sort of, I understand it's to re-energize and re-engage with PHAs. Is there going to be any kind of approval or feedback sought from the board? And really, I have my probably ill-informed opinion on this, and I don't know when it's beneficial to share. So that's really what I'm getting to.
To be honest, we haven't talked about anything super specific, but if the board wanted any particular information, we can definitely share that with the board or keep open communication.
Okay.
Whatever information.
Yeah, I think maybe it just behooves me to maybe attend some of the work group, because I do have concerns. And again, it's probably ill-informed. But I just, folks who are scoring for, that have high vulnerabilities, I just hate, I feel like if there's a way to, and I know I'm probably speaking to the choir, but to engage with PHAs to identify mainstream voucher holders and prioritize them for move on strategies instead of, populations that, may not be successful. I don't, I hope that's not inappropriate to say, but I know you're so appropriately respectful of the client, so you might can speak to this better.
Yeah, and the vouchers are for people. The target population for this would be people that have been in supportive housing for at least 2 years. Some models recommend people that have been housed for at least 5 years. And so we're really making sure that they have very stable rental history, they have consistent, reliable income, especially like if they have Social Security. It's where they don't need all of the services that are provided, but they really do need the rental subsidy. That's who we're really targeting with the move on strategy.
The goal is to move people from permanent supportive housing on, so you can open up PSH that has the services for those people that have high acuity and are moving out of homelessness.
Yeah, I totally get that it is an appropriate flow strategy. And you guys are so conscientious. So I know you guys are the right folks to be at that table. I just wouldn't mind being a fly on that wall.
What I'm hearing, Joan, from you though, is potentially an additional strategy, which would be also to work with PHAs to say, are there folks who have now gained stability because with you over time, because they've had a subsidy for a while and might be able to make it in the mainstream market now? Is that also a strategy to clear up, room for people who do need an ongoing subsidy, but maybe not so much support?
Agreed. I just feel like it's probably the more target population to create that flow. But
coming from working in a municipality, although I'm not specifically with our PHA, one of the things I observe being so close to our PHA is that there's not a service component. It's very much just around the housing because that extra piece of support isn't there. So I'm just wondering out loud if we did think about a strategy like that, which I think is a fantastic strategy because we all know we have, same problem in public housing or Section 8 and subsidized housing as we do in our permanent, which is, more need than supply. How could we have a contingent of folks in a PHA that are looking at, moving people on instead of just being focused on, rent, let's look at the whole family and see what we could do there. So is that strategy in our regional portfolio at all, MAG staff or anyone familiar with the housing portion of the strategies?
Madam Chair, we do have a strategy to work closely with the public housing authorities and looking at tactics like prioritizing the housing vouchers. And so I do think that would be in very good alignment with what's being discussed right now.
Yeah, maybe adding not just prioritizing the housing vouchers for our population, but doing a move on strategy within subsidized housing. That would be great.
Absolutely. One of the next steps, particularly after the forum tomorrow, and after we get some initial feedback from folks around, is this the right set of strategies, is to provide the tactics as well as a cost component. And so we'll be working very intensively on that with the strategy team and with our consultants over this next month.
This might be a great moment to slide that in there because you'll get the PHA reaction tomorrow then, perhaps.
Absolutely. Thank you.
This is Jackie, and I love the idea of working with Housing Authority on the existing vouchers as well. My concern is, and I say this respectfully, but the rules and regulations around the vouchers from the Public Housing Authority are very rigid. And because the rules and regs that they have to follow, My concern, and it goes to the point I think that Joan was getting at, is I love the idea of if we believe, we've had conversations with the individual, they believe they're ready to strike out into more higher level of self-sufficiency. I think that's great. I think it should be supported. But are there mechanisms we could put in play that, the way the voucher system works now is once you lose that voucher, you're done forever. What a travesty if we took somebody out of PSH, their chronic condition may be managed, but it's never likely to really go away. Are there any accommodations we could agree to implement that if in fact a chronic person had a relapse and needed to get back into that permanent supportive unit, that there would be some accommodations? I'm not sure if that's reasonable. I'm not sure if this makes sense, but I'm very concerned about the ability to be long-term self-sufficient.
That's a great point, Jackie. And that's one thing that we talked about when we first got going, was to how we could create a safety net within our system in case that did happen. There's a toolkit, and there's a couple of different ideas and strategies in the toolkit. One that sticks out to me that I really liked is that if our community agreed to it, there could kind of be like a caveat in the coordinated entry system that if somebody who got a move on voucher for whatever reason, wasn't keeping that, something happened where they're losing that, or maybe they already lost it, that could they be reprioritized in coordinated entry to, get back into supportive housing or whatever intervention that they were participating in before. Charles was in a lot of those conversations. I don't know if anything else sticks out to you, Charles, or not, but that is one thing that was talked about, and definitely something that we could talk about again is a safety net.
I don't think we ever came up with a specific solution, but it came up a number of times because that was a concern. And we didn't want to set people up for failure because we know that sometimes things are cyclical. Sometimes, they're in permanent supportive housing because they have a long-term disabling condition. So, yeah, absolutely.
Yeah, I think ultimately, you guys are doing exactly the right things. It's re-engaging and re-engaging and having those conversations with PHAs, because then I think, it'll be them looking at their own pool, but also creating kind of a support system, or like you said, the safety net for this targeted population. So thank you for leading this conversation, Stephanie.
Okay, so can I entertain a motion to approve the Move On Ad Hoc Work Group reconstituting?
I can make that motion. Oh, sorry. It's Eric. Move or second, either one.
I'll second.
Okay, so I have a motion from Eric and a second from Samantha. Sarah, can I ask you to take the roll call?
Absolutely. We'll start with you, Co-Chair Ryan Balch.
Yay.
Thank you. Eric Cole.
Aye.
Thank you. Elizabeth DaCosta.
Aye, and just great job bringing it back to the forefront. Aye.
Thank you. Marshall Franklin. Tad Gary. Well, I think he must have had to jump off. Samantha Jackson.
Aye.
Great. Bruce Liggett.
Nice work, Stephanie. Thank you. Aye.
Great. Thank you. Joan Service.
Aye.
Thank you. Charles Sullivan.
Aye.
Thank you. Jackie Taylor.
Aye.
And Co-Chair Tamara Wright.
Aye, and thank you so much, Stephanie.
And the motion passes. Thank you.
All right, thanks so much, everyone. Glad to see that get moving again. to move on. Okay. Number 9, request for future agenda items. Do any board members have any action or discussion items for future meetings? I know we have our plate full and we all have timelines in our mind of everything that's coming forward from strategic planning and whatnot. So members of the audience, don't take our silence as a thought that we don't have a future on our minds. We certainly do. But nothing additional anyone wants to add today? Okay, thank you. Is there anyone on the board that has any last announcements or events they would like to highlight?
I have something just to save the date. I know Sarah sent out an email. We have our learning session that is scheduled. Oh darn, I don't even have the dates on me. I think it's the 17th through the 19th, but Sarah sent an email to everybody. And I just wanted to remind everyone that Maricopa County, everyone has access to everything from Built for Zero. You have access to all of our templates. You have access to our data. You have access to me if you would like it. And so if you want any of those templates or want to attend the learning session, please just let me know and I'll add you to our list.
Awesome. Thank you, Tamara. Anyone else? Any happenings around our region? I know everyone has lots going on, so great time to share it. Friendly reminder from Sarah on the chat, please fill out the doodles that have been sent to get our time scheduled. Joan?
I would just like to say congratulations to NAC for their Dunlap Point property. It was the first time I've been out in public around humans, 3-dimensional humans, and it was pretty cool. So happy to be there, and it was amazing.
It was an amazing event and great weather, an incredible property. And I know that Dee Dee is listening on the line today. So congratulations, Dee Dee. We're all so proud to know you. And also I'll just repeat something for Dee Dee. She is happy to take anyone who couldn't make it. She's happy to set up a tour with you, to show you around. There's recovery and treatment on site. And of course, permanent supportive housing. It's really amazing. And the property itself is a sight to behold. So I really encourage everybody to take Dee Dee up on that offer and go out and see it. So thanks for that, Joan.
I do have one small thing. It's not exactly in our space, but we've got some folks in our college at ASU that have been helping coordinate the people power at the vaccine sites. And you may have seen there's been a big drop in volunteers just because of, more and more people thankfully are getting vaccinated. So if anybody listening or on the call has potential volunteers that would be interested, I guess connect with me and I'm happy to direct them to where to sign up. You may know it's through the Hands on Phoenix link, but we're just trying to, particularly for State Farm Arena, because it runs all night, we're trying to help recruit volunteers.
Oh, that's good to know, Eric. I didn't know that volunteers were needed.
Yeah, it was initially a good way to get a vaccine because but that of course now it's open to all age groups over 16, but still you could tie in your trip.
Wow. I know here at the city of Chandler, sometimes we give employees opportunities to volunteer as a within their work day. Is that like a just as a way of volunteerism? Is that something?
Yeah.
Okay.
As far as I know, it's through Hands on Phoenix. So they can certify it all and how you have to sign up online, et cetera.
Okay, very
good. I'll put the link in the chat.
That'd be great.
Cool.
Madam Chair, may I just for a moment? I would encourage everyone to volunteer. I volunteered at an overnight shift, and it was one of the most impactful things that I've done. I mean, just absolutely incredible. People are just so grateful and coming together. And it's just like the biggest group hug you could ever experience. And just to be able to be part of the solution when on a number of levels, it feels like our lives have kind of been in limbo for the past year. So being able to do something good for the community was just tremendous. I'd highly recommend volunteering to anyone.
Super cool. That's awesome. Thank you. What else? Anyone else? All right, well, if there's nothing else, that is all we have on our agenda today. I mean, we got through it on time, a little bit ahead of schedule. I'm truly amazed. So again, thank you for Matt staff. I know we didn't, introduce you today because we were concerned about time, but I see Amy and Sarah and Brandy and Julie and Steve and Tina. I see so many people on the line, keeping us in line and making all the workflows. So thank you so much for your continued excellent service. Is there anyone else before I say that magic word? All right, if not, thanks so much, everyone. The meeting is adjourned. Have a great week.
Thanks all. Bye-bye.
Bye-bye.
Bye. Thanks, everybody.